Hi, good afternoon. This is Ira Sahai. I'm a metabolic health coach, a member of dLife, and also its media head. And I bring to you today, this Saturday afternoon, a very special interview with Dr. Neha Sadhwani. And Dr. Neha is a dentist, and here's her, short intro, a very interesting one. She's a dental surgeon by education, has been practicing from the last 6 years now. She's also associated with data management of oncology research in association to US healthcare. And Dr. Neha, welcome and thank you for taking time off out to speak with me. And would you tell me, being a doctor, being a dental surgeon yourself, why did you feel the need to study nutrition?
Hi, Ira. Thank you for having me. And thank you for such a wonderful introduction. Well, I started looking for answers on the nutrition from a very long time. Actually, I've been into fitness and sports all my life. But I think what tipped the scales for me were my parents had an accident last year, early last year, and though the doctors were known and everything, there was some irresponsible behavior among them and everything went well. And after 2 or 3 months, I saw my father had a sudden bout of high diabetes with blood sugar as high as I think 324 to be precise. And I was shocked because my father usually is very healthy and active person. And around that time only, I had learned a little bit about carnivore and low carb diet and keto diet because I was also into fitness and my brother is also into bodybuilding. So we always discuss these things. And after my parents' episode, I was sure that, I don't want to rely on any doctors per se. If you want to rely on doctors, it should be only if there is a RTA or a road traffic accident. Otherwise, your health is in your control. And I don't mean it to shame doctors. I know they are doing the best that they can, but our health is something is always in our hands. So my friend also suggested me about Mr. Shashi, and I was following Shashi ji for some time, and I saw he was in specializing in diabetes. So I spoke to him. I took his consultation from my dad. My father spoke to him. He was influenced by him in a great extent. He changed it, everything, diet and everything. And within 15 days, his blood sugar was 117. I precisely remember. Within 15 days, and I was very shocked. I was like, I've not seen these kind of results in my practice ever. Then also 1 year went by. I was following low carb, this, that, and all generic information like eat less, eat intermittent fasting, and more protein. But what I didn't understand was all the pulses, legumes, and everything are not as much of source of protein rather than carbs. And I did not understand about the carb restriction at the time and about the medical aspects of it. So Shashiji had told me about the nutritional course, but I was not into nutrition because I had taken a lot of courses before on nutrition. It was not that advantageous. Then a few months back, I spoke to another friend of mine who is Vineet from dLife itself, and he told me this is the thing, and I was actually looking for answers to learn more about low carb. He told me this is the best platform, and to be honest, I did not search for anything else. I was like, he's there, and I went on the website. I spoke to you right after I spoke to him, and I saw Sean Baker's Dr. Sean Baker's interview with you, and I was like, okay, this is something else. This is not just nutrition. And then I saw, like, you guys were treating so many diseases. So it's like, okay, this is not nutrition. I need to get my hands on it. I spoke to you, I spoke to Mr. Anup, and I was there.
And the rest is history.
Yeah.
So, yeah, Dr. Neha, tell me, of course, you've answered to a great degree. Why did you come to, and how did you rather come to the life? But over and above everything that you are already doing, and the courses that you were looking out for, how did you, finally come to the conclusion that the life is the course for you, the diploma program?
What I loved about it, Ira, is it doesn't just tell you about what's good to eat and what's not good to eat. It has a lot many things in it, like how you follow a certain that diet, either keto or low carb, and what are the useful advantages of it. What are I've not heard of disadvantages so far, so I won't go there. Um, and the best part about dLife is like you have all the, I mean, most of the at least research papers available on the forum, and so many diverse field people are there. There was MHC. I mean, MHC was huge thing for me because I had never thought that nutrition can. I mean, it affects everything, but then I had no idea that it can also influence your mental health and Alzheimer's and all those other plethora of diseases that we see in the world right now. And even after joining dLife, I was not very sure what I'm getting into. But after MHC, I think my mind was actually blown, seeing so many aspects of it. Yeah.
So that's kind of a history created as far as India is concerned, because India has never had such a global metabolic health conference. About 47 speakers, the top names in low carb and metabolic health, all doctors spoke in the last metabolic health conference, and about 36, 37 doctors this time. So as you know, this metabolic health conference also made its way into a research paper published from Canada, and as creating a big impact in India. So very interesting to know that. Dr. Neha, tell me, now that you're going through the course, what are the things that you like about the course, being a doctor?
One of the important things, like I said, research papers are there, so it becomes very easy to search on any disease, any topic right there. I think the content is tailored in a way a layman can also understand. So a person doesn't need to be a doctor or from medical background to understand the basics of everything, and it's given in a very precise and concise way there. I like that because it becomes easy for other people at least to learn and understand the processes which are actually very hard to understand. And there's forum, I can ask any questions, and there are plethora of diseases and the case studies and everything that there is on forum. And plus we have a support group where we speak about everything, and we have doubts, we can connect with other members. I think that is one of the really good things I feel is in the course.
Yeah. So you've largely spoken about the forum support as well. So I see you a lot participating in the WhatsApp chat discussions, and a lot of fun there. What would you have to say about all those things? Plus the recipes. I'm sure you must have begun, experimenting and making those recipes as well.
Well, funnily enough, I didn't used to eat meat as much. I had also gone vegan and vegetarian, horribly went bad, but I was not into meat and, all that animal love kind of thing. But I think over 2, 3 months, I have started buying meat. I've started making them. I've started experimenting with them. And I used to hate ghee and tallow and the smell and everything of it. And now I'm like gobbling it really nicely. So I don't know how that happened, but yeah, it has been happening. Like even now, I had a plethora, like good, nice meat of my own that I cook myself. So yes, I'm trying a lot, and yeah, it's been fun. Nice
Yeah,
journey.
and we all are there as a community, be it doctors or be it IITians, the defense people. We are all friends and colleagues who are always having each other's back. And Neha is quite active in the WhatsApp group, and I'm so glad to hear that she started her own personal journey of LCHF, and not only LCHF but going carnivore now. Amazing. So, Neha, tell me, what would you like to, advise doctors like you, especially who are working already, doing their best in their field? Why do you think they should do this course, and how is this going to benefit them?
I feel there is a lot of information out there in on internet, but it's very scattered. And there are many variations of what is spoken, what should be followed, what not. I understand that a lot of nutrition is based on, sports, and a lot of nutrition out there that is based on bodybuilding or fitness and everything. But apart from fitness, I think only nutrition when it comes to what you're putting in your stomach is very important now that I am researching about it and studying through the life from so long. It's not just treating the like disease, it's treating the cause, which is mostly based on how our lifestyle is. So I think I'm sure every doctor is doing best of what they can to treat any person, but if they understand the huge effects of nutrition on every sort of disease and how every, at least metabolic disease, are connected with, food that we are eating, the quality of food, and the meaning of low carb and high protein and high fats, especially fats. We fear fats so much, but now that I'm having them, it feels really different. It's a different ball game altogether. So I think doctors should enroll and understand and learn, so that they understand that what they are doing can do a lot, it can put a lot more impact on people's health than they are right now,
Mm. I
as
agree
per
with you.
me.
And as Dr. Neha said, there's a gap between the goals that we are trying to achieve as workers in the healthcare industry, and when we are talking about the metabolic syndromes. A lot of times, it's not just the medicines that are needed, and in fact, as Dr. Neha said, the nutritional intervention or the low carb intervention needs to be the first line of intervention that everybody must consider. And therein, we come to fill in the gap, especially when it comes to Indian LCHF, Indian low carb high fat. dLife has 3,000 plus combined success stories of diabetes reversal and all metabolic syndromes. And dLife was founded in 2014, as most of you would know, by Anup Singh, an engineer and a silver medalist from IIT Roorkee. So since 2014, dLife has been the only, is the biggest, oldest, and the only award-winning low carb platform in India, and globally recognized, globally respected for its huge low carb resource and the huge, one of the biggest low carb resources in the world in terms of success stories, plus 2,000 plus original keto, carnivore, and vegetarian recipes catered to Indian, taste buds. So, and besides that, the dLife Diploma course that Dr. Neha is currently doing comes from the dLife platform itself. And this course is legally attainable in India. So, if you're a metabolic health coach, certified metabolic health coach, you have to be from dLife in order to be legally attainable. We are CPD SO UK accredited with the 60 global hours credit, which is the biggest in the world. We are also the SMHP approved CMHE provider. The course gives you free access to dlive.in platform that has all these resources that Dr. Neha talked about, the success stories, the recipes, the discussion forums, the podcasts, the libraries, and everything else. And we have the largest content on low carb nutrition and metabolic health, which is 800 plus references in the course itself, 200,000 words. More than that, 60 relevant videos. Lifetime access is there to the course. There is no recertification clause. We have one of the biggest libraries of low carb resource materials. We have a robust forum of discussion and long threads on cases. So whenever Dr. Neha starts taking up clients for LCHF, she will have to probably just search and it will be all there on the forum. Every case as it has been handheld. And for further guidance, she can speak to any of the mentors, put in a discussion, start a discussion, and Dr. Neha or anybody, any of our enrollees can take on clients and do whatever is needed in that particular case. We also have a 24/7 WhatsApp community support where we all are a part of, and we all have a lot of bonding, fun, and learning, of which Dr. Neha and I are also part. So, Dr. Neha, so wonderful to see you today and to be able to chat with you. And doctors enrolling in the dLife Diploma course is so inspiring. And, that gives us hope that we can, after all, work together. The medicine, the pills, and the nutrition both can, be combined to give the best results possible if you're talking about India being a metabolically unhealthy country now, largely. Any last words there?
Yeah, thank you. I think, Ira, what you said is too correct. It's not just pills, it's not just diet. I think if you have already gone to the place where you have the disease, you have to work with both and, manage somehow. And I'm sure the diet can rule over the medicines, and people have reversed their diabetes and other diseases as well, like yourself. Uh, I still feel that the one thing that I would tell anyone who listens to this is our health is in our control. It's not in anyone else's, no doctors, nothing. So eat good, eat that is giving you nutrition, and exercise. That's really, really important. And look after your body because that's the only thing you have got.
Yeah. So dLife Diploma Course adds value to practices of doctors like Neha, which she just talked about. I'm sure you will find this video helpful if you're willing, if you're wanting to know a bit more about the dLife Diploma Course, or you were looking for some information. This review video will help you take that decision. Thank you so much, Dr. Neha, for coming and speaking to me this Saturday afternoon. I'll see you around again next time. This is Ira Sahai signing off. Bye bye.
Thank you for having me.